Medication reconciliation. Now, this has been a problem in every single hospital I've worked in, ranging from larger academic medical centers to more rural hospitals. And we have to ask ourselves, why is it such a problem? Why is it such a problem to get an accurate, detailed list of the patient's medications? Well, there are many reasons why. The first, most obvious reason is that patients often don't know what medications they're on. Very understandable. If a patient is elderly on multiple different medications, it can get very confusing. The second reason is that often there will be lists available for the admitting doctor, but there will be 3 or 4 different ones. There'll be one on the internal hospital system, there'll be one from the primary care provider, one from the pharmacist, and then the patient will give you their own list, all slightly different. So those are just 2 of the reasons why we can't reconcile medications properly on admission. So what are some solutions to this? Studies are increasingly showing that the best people to perform medication reconciliation are not the doctors, but are actually the pharmacists. A typical doctor performing a history and physical will only be able to dedicate a small amount of time to the medication list. Frequently it's under 5 minutes. Whereas a pharmacist will be totally focused on the patient's medications. The ideal scenario would be to have a pharmacist stationed in the emergency room to get a detailed list as soon as the decision is made to admit the patient, present this list to the doctor, and from then on, we would know that we have the correct medications. Now, I have heard some people in various organizations say that it would be very expensive to have a pharmacist stationed in the emergency room. Well, that's true, but think about this. Think about the cost savings long term when we reduce medication errors. The Institute of Medicine estimates that every hospital patient, on average, suffers 1 medication error per day. Now that statistic is truly staggering. And having a pharmacist reconcile the medications will go a long way towards solving the problem. What we really need is a simple no ifs, ands, or buts medication list for every hospitalized patient.